Hello, I'm Dr. Vicki Coe, and this video is going to be on how to organize and utilize your family first aid kit. On behalf of the Emergency Preparedness Committees for the towns of Woodside and Portola Valley, WPV, CERT, and Ready, we want to thank you for taking this step to ensure your family's safety during an emergency. Okay, so let's get started. You're going to need your first aid kit. You're going to need some large and small Ziploc baggies, non-reusable. I'll explain later. You're going to need a Sharpie marker and a label maker if you have one. So imagine the earth starts shaking, windows are breaking, there's glass flying everywhere, and you realize somebody has been injured. So the first thing you're going to do is run to get your handy-dandy first aid kit, and you're going to open it up. And this is what it will look like when it comes from the store. This is not good. This is what your kit will look like by the time we finish this video. Being organized allows you to be much more efficient at helping someone. So we're going to move this away now. The first thing I want you to do is to dump the contents of your kit on a table. And we are going to learn what every item that's there is for and how to use it. The first thing you need to put out is your PPE, or personal protective equipment. So that includes your mask, your goggles, and your gloves. And the reason you do this is because if someone is injured and you initially tend to them, you may have blood on your hands at that point. You don't want to contaminate the entire content of your kit. This way you just open one pocket and you have everything you need to protect yourself. And then you label it with a Sharpie marker, PPE. The next thing you need to do is find the tools in your kit. And you want to have them in the pocket on the other end. There's a small little pouch inside of that where you can put them so that you easily can find them and you can carry them away with you if you need to leave from where your bag is. The things that are in this pocket will be bandage scissors. These can be used to cut bandages. These can be used if you had to cut clothes off of someone. They can also be used to cut the splint that we'll show you later. There's a pair of forceps in there, and these are grabbers or clamps, you can call them if you want. These can be used to pick out large pieces of debris. They can be used to clamp something if you're trying to hold something in place. These are very useful. There's a seatbelt cutter in there, and this, very importantly, is a tourniquet. And if someone is bleeding massively, you want to be able to find this quickly. Other things you might consider adding to your kit that do not come with it are pen and paper, a Swiss Army knife or the equivalent. I use a headlamp because it frees up your hands. If you have to use both hands to do something and you can't see, this is very practical. And the other thing is I have a heavy-duty flashlight. This kit was designed with the focus on major injuries you might see during an earthquake. Many of the things you find in this kit can be used for other scenarios, but it's heavily weighted towards injuries you are likely to encounter after an earthquake has happened. So what kind of injuries are most likely to occur after an earthquake? First is cuts or lacerations. Second are scrapes and bleeding, scrapes and abrasions. Think road rash, and either of these can lead to bleeding. The next kind of injury you're likely to encounter are orthopedic injuries, meaning broken bones, sprained ankles, ligament tears, ligament sprains, dislocated joints. So you have equipment in here to deal with those as well. The third kind of injury you might encounter are injuries to eyes. Debris flies, it can get in people's eyes. Your cornea can get scratched. So we have supplies in here to deal with those things. The fourth thing you might encounter are burns. And the fifth thing you might encounter is someone in shock. If you find a victim who has been cut by, let's say, shards of glass and is bleeding profusely, bright red bleeding, it's pumping, your first instinct should be to take your gloved hand and to put pressure on it, which is a treatment for stopping bleeding. If it's not as severe bleeding, then take the time to pull out your bag labeled bleeding and lacerations and use a sterile 4x4 to put pressure on so that the layer against the skin is a sterile layer, which means it's in a package and it's clean and germ-free. The other things that you have in this bag to use are, and I'll show you how to open a sterile package. What you want to do is grab the corners and pull the two layers apart. Do not touch the contents inside. Pull it back like this, and you grab it with your gloved hand. Your gloves are not sterile, but they should be clean. You pinch it between two fingers like this, and then you float it down onto the wound and continue putting pressure on it. You also have a combine pad. This is a bigger version of a dressing. This is 5x9, and this is for bigger cuts or something that's small but bleeding profusely. Again, this is sterile packaging. You have to do the same thing. And in here, you've got a whole pile, 200 4x4 gauzes. These are not sterile, they're clean. And this should be used if, let's say, the bleeding continues, you're still applying pressure, you need to apply more pressure. Do not remove the first gauze that's sterile, just pile more of these non-sterile ones on top and continue holding pressure. If you finally get the bleeding under control, that's great. Then you can wrap the wound, depending on the size of it, with a gauze roll called Curlex, or here they call it crinkle gauze roll, or you can tape it in place. If the bleeding doesn't stop as a last resort, then you use a tourniquet, which is in your tools bag here. If someone has a more minor cut or an abrasion, road rash, that sort of thing, the most important thing you need to do, if it's not bleeding, is to irrigate the wound. And in your two front pockets here, you have a bulk syringe. It's like the thing you used to clean your kid's nose out with when they had a cold. And you have sterile water, sterile saline, excuse me, and you can use this to irrigate the wound to get it out. If you don't have access to this, you run out of this, just water out of garden hose is fine at this point. If somebody has a really debrided, horrible surface, it's got all kinds of dirt from shards or whatever in it, you may want to wipe that transiently with betadine and then rinse that off, and that will sterilize it. You also have a package of antiseptic applicators. These are betadine applicators. You've got some alcohol in here, and these are just for cleaning the skin area, not for cleaning the inside of the wound. So you just label those so you know how to reach for them immediately. So it's important that you always put your things away, assuming that they have not been contaminated, so that they're ready for the next time you need them. And I put them in order of what I would use first on the top. So that would be the 4x4s and the combine pads. If you notice that a package is sort of torn or ripped, it's no longer considered sterile. So you should not put that directly on the skin wound. The next bag we have in here is the final dressing. So once you've taken care of the bleeding and that's no longer an issue, then you need to dress the wound. And you can do that in a number of ways, and this compartment has items that you need for that. If the wound is gaping, you can use steri strips to pull the two sides of the skin edges together. You can also use a Tegaderm, which is a totally adhesive sticky thing, and this will, if you put antibiotic cream on the wound, always ask the patient if they're allergic to anything before you do this, then you can apply this over top of the antibiotic cream and it'll stay in place. Other things in here are something called Coban. It's an adhesive dressing. It sticks to itself. This is great if you have a large wound you need to wrap, because you can wrap it with this and it will adhere and keep the dressing in place. And you can see how sticky it is when you pull it, and it's stretchy. The other thing you have is eye tape, and what's important about this is it's latex free and it will not irritate the skin. This is the other thing you can use to secure a dressing. The reason to keep these two bags separate is when you're using the laceration bleeding bag, you may contaminate the entire contents of it. You want to be able to then throw the whole bag out, because you can't rely on this being uncontaminated, which is a reason not to use reusable plastic bags. This one you keep separate because you've got the bleeding under control. This is just to put the final dressing on, which is why they should be in two separate bags. Your next large bag will be labeled ortho, or orthopedics, or broken bones if you want to call it something more identifiable. And what we've got in here there's a SAM splint, and I have one over here that's open so you can see it. This is 36 inches long. This can be cut for smaller things. If it were just a wrist, you can cut it to a shorter length. It's malleable, and you can immobilize a fracture or a sprain, and you're not going to know for sure which it is. You put this on the patient, and then you use an ACE wrap to secure it on the patient. It should be above and below the break. Many patients that have either a dislocated shoulder, let's say, or an arm that's broken will guard. They'll hold that extremity against their chest to try to keep it immobile. And to help them do that, we have triangular bandages, and there's a short video on the website that teaches you how to make a sling out of this, so it's worth watching. The other important thing about treating any kind of fracture, sprain, it's going to swell. And we have little instant cold packs in there, and you should apply this not directly to the skin, put something on top of it, and this will help reduce swelling, as will elevation. Oh, and this can be cut with the bandage scissors, which is why we have this bandage scissors. Next, in the small compartments in the front, I don't know if you can see this, this thing has an inner compartmental divider. There are 8 small compartments in the front, and then there are these large ones in the back. So the things that have less items, we put in the smaller, and the next one is for burns. If you're treating somebody who has a burn, number one, you need to cool the burn down. And you do that with, if you have sterile water, sterile saline, you use sterile saline. If you don't, whatever you have, tap water is fine, just cool the burn down. Once you cool the burn down, you need to dress the wound, and always use sterile 4x4s against a burn. Also included in your kit are these things called burn shields. These are also excellent for being a burn dressing. People that are burned, especially if it's an extensive burn, lose a lot of fluid because the skin's not holding it in anymore. They get dehydrated, and they also get very cold because they're evaporating that fluid. So there is a Mylar blanket inside with the burn stuff, and you should always think about keeping that patient warm. The other Ziploc in one of these front compartments is for shock. Shock is when the body is not delivering oxygen to the organs, and if someone in a state of shock can die because they basically are not getting blood to their heart or their brain. The causes for that are many, but probably the most likely you will encounter is someone has had enough of a bleed that they no longer can carry oxygen. Oxygen is carried on hemoglobin molecules in your blood. So the important thing about shock is to treat the cause of the shock. If somebody's bleeding extensively, that should be your primary focus. However, other causes of shock that you can treat that are in this little bag are someone whose sugar has gotten too low. This is a hyperconcentrated sugar solution. There's smelling salts in here. I'd say the only real use for these is just to see if somebody is just fainted or they're truly unconscious. And again, it is critical that you keep these patients warm, unless it's from heat stroke, in which case you don't want to do that. So there's a Mylar blanket. And another large baggie is for eyes. And this contains ophthalmic solution that you can use to irrigate someone's eye. It's much better to flush out debris with a fluid than it is to try to pick it out. So you can just use copious amounts of this to get anything out of the eye. If someone has a scratch of their cornea, something has hit their eye, you may want to patch it, and you have oval eye patches in here. And to attach these to the patient, you place it against the eye, make sure that their eyelid is closed, then you use the eye tape and go from their forehead down to their cheekbone. And that'll secure this and keep the eyelid from rubbing against the abrasion, and it helps it to heal. And lastly, I have another bag that's labeled hazmat. Anything that has been contaminated by blood or any other bodily secretion is not acceptable to put in a trash can. You have to dispose of it separately. So I carry a little bag around where I can put any of the bloody bandages in this and then dispose of it appropriately. And just a brief word about COVID, since we seem to be stuck with it for a while. I have extra supplies in my bag specifically to protect me and protect the victim from either of us transmitting COVID. You have to assume that anyone you come in contact with, and possibly you, could be a carrier. So I carry extra masks, which we put on the patient. There's several different types of N95 masks. This mask will not protect you from getting COVID. This kind of mask, which is an N95, and it's important to check and make sure it's NIOSH certified, will protect you, but because it's got a valve, that's not effective at protecting the victim. The other N95 mask that is the kind you should have is this. like this, so there's no valve in it. Therefore, you can't exhale anything on the patient. Other things I have are an O2 sat monitor, a touchless temperature monitor. Because you may be going through a lot of gloves, and if you're not doing fine, delicate work, you don't need nitrile gloves like this necessarily, which are more expensive. You can just get a bag or a box of these food handler gloves. So let's say you need to grab something out of your kit. This is perfectly fine to grab stuff with. Can't suture with it, but you can grab things. Also, hand sanitizer should be in your bag, as well as some sort of disinfectant. The betadine that you have in your kit, if you have to use any of your tools, this is effective at killing COVID, and you can sterilize your instruments with this. So the way that things are placed in this bag is so that I can grab the supplies for the most serious of injuries. Those are in the center compartment. The other things are distributed around the periphery. For example, the eyes are in this side compartment. It's very important that you keep your tools and your PPE easily accessible. And when you place things in your bag, make sure that you can see the labels. So you can either go immediately to what you need, or you can instruct somebody else to go grab the bag that says bleeding, and they will come back with what you need. This course is not intended as a first aid course. It was intended to help you know how to make your first aid kit as user-friendly as possible, and to familiarize yourself with the items that are in it and know how to use them. Being organized means you can be more efficient and more effective at treating a victim. Thank you so much for tuning into our video, and hope you never need any of this information. On the video, you will see a link to this, which is on WPV-Ready. And this contains all the information and pictures of the setup that you've seen today. So you can refer to this when you're trying to get your kits together.